well in micro health insurance, and your company in particular, your country also is moving fast in micro health insurance. I know for certain, I've been visiting Bangladesh, so no, you do not have a very strong private health insurance segment growing there. It's still in the nascent stage. How is that Bangladesh has been doing so well? And if I look at the various health indices, I find Bangladesh has been doing better than India. If you look at maternity mortality rate or infant mortality rate, on all those parameters, Bangladesh has been doing well. What could be the reason that Bangladesh does so well in micro health insurance?
Thank you, Professor Chattoraj, and very good afternoon to all the respected panelists. It's a very important question you have asked, Mr. Chattoraj, is what has been the success factor behind these mass level primary healthcare achievements for Bangladesh? If we want to dig deep, we have to touch upon few critical points, and we have to go back to the origination of these huge achievements. Let me just start with the how it started actually in Bangladesh. After the liberation, in a war-torn economy, a lot many things needs to be rebuilt. And after 1971, a few visionary individual of Bangladesh who has taken initiative on their very personal note, connecting the global communities to rehabilitate the entire socio-economic structure of Bangladesh along with the then government. One of the very promising efforts that has brought results to this stage is the participation of the NGOs. Now we all know a couple of names, if I may mention here, is one is Grameen Bank, the other one is BRAC. These two NGOs have really embanked on the success of this today's community health parameters achievements. Now, how it started? When these NGOs have started working, they were bringing they were managing a lot of donor fundings to bring in some social changes, to bring in some moral values into the ecosystem of the war-torn country. One of the few things that they immediately realized once they started is what could be the success factor of this huge vision. They identified two things. One is access to fund is very important. The very next thing is how they can ensure the accountability to access this fund. Now, we all understand what is the access to fund is all about, but how they ensure the accountability, they immediately realize that if they give this fund, no racism, but if they give this fund to a male individual, the fund may not be utilized the way it will be utilized if the same is given to a woman. And that was started with a very hypothetical note, but eventually that has brought a result which the world is really astonished today. The woman of a family, the woman of a society is symbolized itself today that they are capable not only of participating in the economic activities, but also they do care about their families from the core of their heart. And whenever these NGOs have started formulating the microfinance strategies, microfinance activities, they soon realize that if this individual, this beneficiary, the woman beneficiary is not really well health-wise, if any of their family members are not really well health-wise, this entire funding will go in vain. So what they started doing, along with the gradual scaling up the microfinance activities, they started plugging in few health elements, health and wellness elements, so that they indirectly secured the funding. So when they started, they learn few things
Uh, uh,
that.
Mr. Moin, I'll stop here. Financing, I could understand. But how the healthcare services are being delivered through microinsurance initiative?
Yes,
Do they
absolutely.
really, the rural people, I've been to rural areas, do they really, are they really able to access healthcare services? I did not find many hospitals in the rural areas, and even if there are hospitals, they are not working. They are like Indian hospitals, most hospitals, government hospitals. So in that case, don't you think insurance in your country face challenges? How did you address the delivery system there, delivery part of the financing? I could understand a lot of donors you get, and uh, that, that's fine. And the way you manage it, even participating in a bigger way, that's also very encouraging. And but what about the delivery of healthcare services? Has it
Absolutely.
really improved in your country?
Yes, it has. That's the point I was coming in. How the health actually came to the stage. It has really piggybacked on the distribution model of the microfinance. Basically, as the microfinance distribution has gradually scaled up, these healthcare facilities, basically, as you have rightly pointed out, there is not much of a hospitals as such in the rural level, but there are one thing called community clinic, which has
Yes.
really changed the face of this healthcare in the
Actually,
rural level.
yes, yes, very well said. The
Yes,
community clinics, the community hospitals are doing wonders. Uh,
absolutely,
uh,
absolutely. There are close to 20,000 community clinics which are scattered across the
and
country.
uh, and it's great to see the kind of intensity with which the community participation takes place in your country. I'll paucity of time, I'll quickly go back to Mr. Nishan Jain. And Mr. Jain, if you can turn on your camera, Mr. Nishan Jain.